Government denies all reports of extension of lockdown period. Cabinet Secretary Rajiv Gauba says all such reports are baseless. Centre forms 10 empowered groups and a strategic task force including senior civil servants to deal with COVID-19 outbreak and its aftermath. The 6-member strategic task force to deal exclusively with issues related to the lockdown. Centre asks states to effectively seal the interstate as well as district borders under privileged sections to be provided shelter and food. Free movement of goods to be allowed, states to ensure labourers get their wages and are not harassed by their landlords. Uttar Pradesh government releases 611 crore rupees on account of MNREGA for 27.5 lakh labourers. Chief Minister Yogi Adityanath also holds discussion with labourers through video conferencing. ICMR approves first indigenously developed coronavirus test kit. Test to cost 1,200 rupees as against the present cost of 4,500 rupees per test. DRDO says it has devised indigenous equipment including multiple-use ventilators and isolation tubes to fight COVID-19 pandemic. Total number of active corona-positive cases in the country stand at 942, while 29 people have lost their lives and 95 have been discharged after getting well. Maharashtra and Kerala have maximum number of active cases. Global death toll due to COVID-19 is past 30,000, while corona-positive cases touch 7 lakh. Italy, Spain, United States and France most affected. All countries take strict steps to deal with COVID-19. Good afternoon and welcome to this bulletin. I'm Shubhendu Ghosh. As India entered into day 6 of the 21-day lockdown to check the spread of coronavirus, Cabinet Secretary Rajiv Gauba has said the centre does not plan to extend the lockdown. The Cabinet Secretary has clarified that the government has no such plans of extending the 21-day nationwide lockdown. The Press Information Bureau in a tweet message said there are rumours and media reports claiming that the government will extend the lockdown of 21 days when it expires. The Cabinet Secretary has denied these reports and stated that they are baseless. Meanwhile, the government has set up 10 empowered groups and a strategic task force, including senior civil servants, to deal with COVID-19 outbreak and its aftermath. These groups have been set up under Disaster Management Act. The groups have been empowered to formulate plans and to take all necessary steps for their time-bound implementation. The Department of Expenditure has issued special instructions to enable expeditious decision-making in procurement matters. Each group has senior representative from PMO and Cabinet Secretariat to ensure seamless coordination. Of these 11 empowered groups, 9 are headed by secretary-level officers, 1 by member Niti Aayog and 1 by CEO Niti Aayog. In case of any need for guidance, these groups may seek guidance from Union Cabinet Secretary as well. And Ministry of Home Affairs on Sunday night suspended 2 top officials and issued a show-cause notice to 2 others on charges of failing to ensure COVID-19 lockdown in the national capital effectively. The MHA in a statement said these officers have failed to ensure public health and safety during the lockdown restrictions to combat COVID-19. Additional Chief Secretary Transport Renu Sharma and Principal Secretary Finance Rajiv Verma were suspended with immediate effect due to serious lapse in their duties to enforce lockdown in the capital, while Additional Chief Secretary Home and Land Buildings and the Sub-Divisional Magistrate Silampur have been issued show-cause notice. The centre has directed states to enforce strict implementation of the lockdown. In an official directive to the states, the centre has asked the states to enforce lockdown strictly. The Cabinet Secretary and MHA are in constant touch with state chief secretaries and DGPs. States directed to ensure there is no movement of people across cities or on highways. Only movement of goods should be allowed. DMs and SPs should be made personally responsible for implementation of these directions that have been issued under the DM Act. Adequate arrangements for food, shelter for poor and needy people, including migrant labourers, be made at the place of their work. Centre had issued orders for use of SDRF funds for this purpose. Sufficient funds are available with the states in this head. States have also been told to ensure timely payment of wages to labourers at their place of work during the period of lockdown without any cut. House rent should not be demanded from the labourers for this period. Action should be taken against those who are asking labourers or students to vacate premises. Those who have violated the lockdown and travel during the period of lockdown will be subject to minimum 14 days of quarantine in government quarantine facilities. Detailed instructions on monitoring of such persons, including quarantine, have been issued to the states. And Home Ministry has asked all states and union territories to allow transportation of all goods without distinction of essential and non-essential during the 21-day lockdown period. In a letter to state chief secretaries, Home Secretary said the newspaper delivery supply chain is allowed during the lockdown. He also said the entire supply chain of milk collection and distribution, including its packing material, has also been allowed during the period. Besides groceries, including hygiene products such as hand wash, soaps, disinfectants, oral care items, battery cells and chargers are also allowed. The Ministry of Civil Aviation is coordinating with state governments for supply of medical equipment and related essential items needed for protection against and testing of COVID-19. And besides, Air India and Alliance Air flights are being operated to carry out the necessary supply operations across the country. In order to cater to eastern and northeastern parts of the country, an Alliance Air flight from Delhi to Kolkata carried shipments for Kolkata, Guwahati, Dibrugarh, Agartala on 29th March. In northern region, Indian Air Force flight from Delhi to Chandigarh to Leh carried ICMR, VTM kits and other essential cargo. Alliance Air transferred Pune shipment to Mumbai on Air India flight. Flights also carried and transported ICMR kits of Shimla, Rishikesh, Lucknow and Imphal from Pune to Delhi. ICMR kits were carried to Chennai as well. Consignment of Hyderabad was delivered. Consignments of Andhra Pradesh, Tamil Nadu, Puducherry were also delivered. Consignment of Ministry of Textiles was moved to Coimbatore. Meanwhile, 24/7 operations for delivery of supplies are taking place to the destinations in a timely manner so that the efforts to fight COVID-19 are multiplied and supplemented. Meanwhile, the nationwide tally of confirmed coronavirus cases crossed the 1,000 mark. Total number of active corona positive cases in the country stand at 942. While 29 people have lost their lives, 99 people have been discharged. They've recovered and they've been discharged from hospitals. As far as states are concerned, Maharashtra and Kerala have the maximum number of active COVID-19 cases. Indian Council of Medical Research (ICMR) has approved first indigenously developed coronavirus test kit. The kit, called MyLab PathoDetect COVID-19, will cost rupees 1,200 as against the present cost of 4,500 rupees per test. MyLab is the first Indian company producing the corona test kit. The first lot of the test kit have been sent to the market, while the second lot is to be dispatched soon. The testing time for this kit is approximately 2.5 hours. And DRDO has said it has devised various equipment, including indigenous multiple-use ventilators and isolation tubes, to cope with COVID-19 pandemic. And speaking exclusively to our correspondent Rudhnath Sanyal, DRDO Chairman Dr. Ajit Sadhanath Reddy said that several new equipment will be rolled out in the next few days for industrial use.
With us today is Dr. Satish Reddy, the Secretary, Defence Research and Development, who is also the Chairman of the Defence Research and Development Organization. So, Dr. Satish Reddy, against the backdrop of this COVID-19 pandemic, what are some of the immediate priorities of the DRDO?
We also have a lot of spin-off technologies which are useful for the civilian society, particularly in the light of the coronavirus, we have found many of them useful to this particular application and made many of these technologies what have been developed useful for the coronavirus protection. Many things have been developed by our many laboratories. We have instructed our laboratories to work on these technologies.
And defense scientists know how to prepare for unpredictable situations, matters and issues that come up at short notice. So, this COVID-19 pandemic has also come with little notice. So, how would the expertise of the defense scientists in this realm help?
As you rightly said, the scientists of DRDO know how to work for situations like this and which come up suddenly. I can very proudly say that the laboratories across the country, the scientists are working on multiple solutions and multiple products and multiple technologies in the last maybe about 10 days, coming out with many solutions and which we need to test and validate and all that. And so on, passing on to the industry also very fast and making the local administration also aware of it quickly, and if possible they are training those people wherever it is required and necessary. Number of products started rolling in. One is the hand sanitizer. We also developed some basically the masks and then the PPEs, the personal protection equipment, the body suits whatever we call it, and then we are also talking about the ventilators, then ventilators using for multiple patients and face masks, and also the full body sanitization also, and some of these things which will be rolling out in the couple of days now.
Right. And what would be some of the follow-up measures?
Today we are concentrating on various products and equipment. Like example, my scientists in the last 3 days or 4 days have developed a product which actually one ventilator can be used for 4 or 8 patients simultaneously. And they have tested in Apollo hospitals day before yesterday, and they have tested in one more ESI hospital, met couple of doctors and found that it is a very useful product, and they try to make it very robust product. I am sure that in the couple of days we should be able to come out, and we are also working on face mask. We are also working on isolation tents, isolation cloth based oxygen tubes and cylinders where people can be put into those type of tubes, and many other related products, and some of the vehicles where you can sanitize the people itself, whole body sanitization. These are all the technologies in quickly in days people are coming out, and we need to test them, and some of the medicines also, and probably in next 3-4 days all these things will get into some maturity and industry starts producing, coming out of the various
both the private and the public sector industry.
Particularly the employees problem, labor problem and all that, they are overcoming that, and I think next 4-5 days we should be able to see a lot of these products coming out.
So, India is not dependent on any foreign technology?
I do not think so, but I won't be able to comment on the medicines and all that, that is not our area of expertise. I am talking about this various equipment and all that and protective clothing and all, we need not depend on that. Enough technologies are available here and enough capability in the industry is existing in the country.
In India, right. And perhaps rapid testing is the need of the hour. How can DRDO help in this regard?
We have offered a couple of our laboratories for testing of this, identifying the people who are infected out of this. Particularly the laboratory in Gwalior has developed this, and we have kits available in laboratories in Delhi, Inmas and Deepas and other places. Lots of tests are happening now. A number of people are, samples are coming and they are getting tested in these laboratories now in a big way.
Okay. And these sparable capacities of both the private sector and public sector industries perhaps can be diversified with your expertise.
Yes, that is what is happening. As I said, Bharat Electronics Limited, even Ordnance Factory and private industries, all we are trying to explore who are all the possible people. Wherever technological support is required, we are trying to give them, and couple of days from now we should be able to see the results of it.
Okay. Couple of days.
Couple of days.
Okay.
In fact, we are testing those OFB, Ordnance Factory Board made products in our laboratory in DRDE for the efficacy of those products, And once I think the test is over and successful, Ordnance Factory can produce in large number through their factories which are spread across the country.
So thank you, Dr. Reddy, for this wonderful interview. Thank you very much.
Thank you very much.
That was an exclusive conversation with Dr. Satish Reddy, Chairman DRDO. He was talking about indigenous development of multiple-use ventilation and other medical equipment to tackle the COVID-19 outbreak. Moving on, giving further respite to the daily wage workers during the lockdown following coronavirus outbreak in Uttar Pradesh, State Chief Minister Yogi Adityanath transferred rupees 611 crore to over 27.15 lakh labourers of MNREGA in the state. At a simple function held at the official residence of the Chief Minister, the funds were transferred to the bank account of the labourers. The amount was spending dues of MNREGA workers who get 100 days' work in a year. We now get some updates from the ground. Reporters are reporting from different points in the country. We first go across to Kerala from Thiruvananthapuram. My colleague Arun Samnath is joining us. Arun, now Kerala really has faced the worst brunt of COVID-19 outbreak in the country, also Maharashtra. So give us an update. How is the situation at present?
Shivendu, you're right. Kerala is one of the states which is feeling the brunt the most. In a close competition with Maharashtra. But the picture, let me give you a picture right now. If you can see, there is the lockdown is pretty effective in the state. Though we had some issues in the initial 2 days, like the rest of the country, but the situation is under control right now. The people have taken up the initiative on their own. The sort of social distancing that the Honorable Prime Minister had asked them, they are following it on a voluntary basis. They are not coming out as the numbers are. But they are coming out only if there are some essential needs to be met for essential supplies or essential medicines. Mind you, I am standing at a place called Kodapanakunnam, which is basically one of the places in the city itself. This road is usually very, very crowded. The government is actually thinking on ways to improve the road width so that it can accommodate more passengers, more vehicles. But right now, there is hardly anybody outside. It is only the people who are coming out for essentials who are out on the streets. Number two, let me come to the steps taken by the government, which are proving to be really efficient in controlling or managing the situation on the ground. Number one is the government has taken a number of steps to ensure that there are essential supplies. The government has actually moved in for procuring essentials for the next 3 months. The government has, through its departments and agencies, started provisions for distribution of kits to people at home. These will be initially restricted to people who are in need of them.
Okay.
The rest of the people can manage on their own, but people like the elderly people who are having some specific medical conditions, these are the people to whom the government is trying to reach to their doorsteps for the supply of essentials and for the medicine. Now, there is one unique thing that has been started for the past 2 to 3 days, that those that are known as the community kitchens. These are run by government departments and the local governments with the active support of the local population and through self-help groups and other agencies which have come up voluntarily. Now, these people are not only making the food to avoid the crowding of people, these are people who are actually trying to take the food to the people again.
Okay.
They don't want the people to come outside. Food will be made available to the people at their homes. Now, the third and the most important thing that I would want to highlight is actually something that is known as Samuhiga Sannadha Sena, which means this is a social voluntary force that the government is trying to prepare.
Okay.
The government will have around 3.5 lakh people in the ground immediately. These are the people who are going to help the government agencies manage the situation.
All right, Arun.
Manage the supply of essentials, make sure that the government has enough people on the ground to work. But let me also highlight two issues that the state is facing.
Okay, very briefly, Arun, we need to get some
one,
updates from other states as well. Very briefly, if you could complete your point.
Number one is the issue of... Yes, Shivendu, yes, I can understand that. Yeah.
Okay, Arun, we'll connect with you a little later again. Thanks very much for joining us with those inputs. Kamal Bora is joining us from Guwahati, Assam, with more update on how the lockdown is coming along. Kamal, give us a view on how the lockdown is coming along. Also, what about the supply of essential commodities to people? Kamal.
Yes, Sovendu, the visuals just behind me shows that how people are cooperating in this lockdown. Today
Right.
is the 6th day and people are observing this lockdown quite peacefully. However, just few days back only what we saw in some vegetable markets in various parts of the state, some chaotic situation took place because police tried to enforce the norms, social distancing norms, but people tried to attack on police, but it was kept under control by police quite immediately. And after that, only vegetable markets are closed till then. So from that period, and social distancing norms are right now are being fully observed here in Assam. As far as other norms, other the facilities are concerned, as you have asked me, how government is trying to get the essential commodities to the households. Yes, certain efforts we have seen from the government side because as the vegetable markets are closed, though grocery shops are open, people, Assam government has, ordered that, the trade license can be
Okay.
issued. Trade license can
Right,
be
Kamal.
issued to the vendors, and they can go to the people's house to house, door to door, so that essential commodities can be supplied to those people. And medicines are available in pharmacy; these are
All right.
open, and grocery shops are open. So this
Right,
is
Kamal.
how. Yes, government is taking every possible measures to get people every essential commodities, and at the same time they have also tried to enforce this lockdown norms, and people are also seen
All right, so we see in a disciplined
manner.
manner Assam is following the lockdown. Kamal, thanks very much for getting us those updates and visuals from Guwahati. My colleague Kamal giving us update from Assam. And now an important information. All cable operators must compulsorily show DD, that is Doordarshan channels by law. In case your cable operator is not showing all the Doordarshan channels, you can report the issue. In case they don't address your concern, you can report the issue to this email ID, that's ddpb.inform@gmail.com. And with that, we conclude this bulletin. News and updates continue after a short break. Namaskar.